guys, how are you doing? Karibu, welcome to today's session of learning. If you're new here, feel most welcomed. If you have not subscribed, please consider subscribing. If you are a member of this channel, thank you so much for always watching these videos. And today I thought of teaching moms about breastfeeding and its importance. Okay, so sometimes you might hear your doctor advising you or strongly recommending exclusive breastfeeding for 6 months, and you ask yourself why. You don't have the reason why he or she is telling you to breastfeed for 6 months. So today I want us to learn and know the importance of breast milk to the baby, okay, and also importance of breastfeeding to you as the mother. Okay, so welcome, and if you have any questions, you will ask me down there in the comment section, or if you feel like you have a topic that you want us to learn about, you can also recommend it down there in the comment section, and yes, I will go ahead and cover it. So what is breastfeeding? Breastfeeding is when you feed your baby with breast milk directly from the breast. Okay, breastfeeding is when you feed your baby with breast milk directly from the breast. Okay, and it's also called nursing. Okay, nursing is just a term that means caring, okay, or yes, taking care of a baby. So breastfeeding moms are also called nursing moms, and this one I know you've been hearing everyone singing after you give birth, before you are discharged. Everyone who passes around you is always telling you to breastfeed exclusively for 6 months. And also many medical experts strongly recommend exclusive breastfeeding for 6 months. Okay, even the World Health Organization recommends that at least you should breastfeed for 6 months before. At least 6. It does not mean that you will stop at 6 months. The World Health Organization recommends that you should breastfeed at least the first 6 months of life. It means that at least you should breastfeed after 6 months, okay, but at least do 6 exclusively without giving your baby any feeds. So you will breastfeed up to 2 years, or as you wish. Some people breastfeed even up to 3 years. So, and this baby should breastfeed on demand. Okay, so how often is your baby supposed to breastfeed? It depends on your baby's preference. Some babies prefer to breastfeed small frequent feeds. Other babies prefer to take long feeds. Okay, yule mtoto ananyonya, anashiba, anakaa for 3 hours, then ananyonya tena. Some babies atanyonya kidogo, after 1 hour anataka kunyonya, after 1 hour anataka kunyonya, depending on how your baby prefers, okay? On demand. Anytime your baby wants to nyonya, just go ahead and breastfeed. So, what are the signs of a hungry baby? How do you know that now this baby wants to breastfeed? Number one, the baby will cry. Any baby who is hungry, mtoto akiwa na njaa, they always cry, okay? Not always, kuna wachache wenye hawali, but wengi wakiwa na njaa, they cry. Number two, they lick their lips. Utaona ametoa ulimi nje, anajaribu kunyonya lips. Number three, putting the hand in the mouth. Mtoto atachukua mkono, aanze kunyonya, okay? Number four, fastness. Kuna mtoto akiwa na njaa anakasirika tu, they become fussy, and then they will start sucking on things. They will just hold anything that they find near them, and then they put it in their mouth and start sucking it, and then opening their mouth. You've seen some babies wakiwa na njaa, they just open their mouth, anashinda amefungua mdomo, and then what they do, they move their head and also mouth looking for the breast, okay? Umeona kama umeshika mtoto hivi, anajaribu kufungua mdomo, anatafuta matiti anyonye. Those are signs of a hungry baby. And so when you notice your baby is hungry, just go ahead and breastfeed your baby. So what is the importance of breastfeeding, or what is the importance of breast milk? Number one, it is very nutritious. It is very nutritious. Imagine, you do not need to give your baby anything. Unaona vile wewe mtu mzima unaendanga kutafuta fruits, utafuta proteins, utafute vegetables, utafute carbohydrates. This breast milk has all this, okay? It has all this, okay? It has a perfect mix of all the nutrients that a baby requires. So number one, it is very, very nutritious. Number two, it is easy to digest, okay? So imagine this newborn baby, digestion system yake haijakoma. So they just need something simple to digest, like breast milk. So kianza kumpea uji, it is for them, the digestion system is not in a position to digest iyo uji, so you give it an extra work. So breast milk is easy to digest, okay? Number three, it contains antibodies. They fight infections, they fight bacteria and also viruses in our body. So imagine if you breastfeed your baby for six months, how strong will the antibodies be? Hata kuwa anagonjeka virahisi. And then it lowers the risk of developing allergies and also asthma, because you see, when you start feeding this baby early, you put the baby at a risk of developing allergies mapema early. You also have, it reduces the risk of diarrhea. Breast milk is sterile, it's clean. Sio kama chakula yenye unapika, you don't know the sufuria you are using, the water you are using to cook the chakula, or the plate or the spoon you are using to feed the baby. So breast milk is clean. You just wipe your nipple and you breastfeed your baby. It's clean, so no risks of diarrhea. And you understand how diarrhea is serious when it comes to babies. Diarrhea kills so many babies. So another thing is it helps in bonding. You see, wakati umeshika your baby, always when your baby is breastfeeding, they are looking at you, and also you are looking at them, and also there is that contact with you, and also eye contact. It helps to strengthen the bond between the baby and the mother. Another thing is it's readily available. It's not expensive. It's not something you are going to buy at the shop. At its fruits are expensive, proteins are, marago is expensive, proteins. Breast milk is free. What you need to do is drink a lot of fluids. Kunywa uji, kunywa chai, kunywa maji, and you have free milk. Another thing is it's at the right temperature. Mtoto akisikia tu njaa, you just breastfeed. There's no struggles, hassles za kuanza kupasha chakula ya mtoto. It is at the right temperature, and also it reduces the risk of ear infections, okay, to the baby, and also respiratory tract infections, okay. Those are the benefits of breastfeeding your baby. As you can hear, those are like 10 points, and they are very strong, because if your baby gets all these, then that baby is a healthy baby. So long as umnyonyeshe ashibe, you will have no trouble, okay. What are the benefits to the mother? It burns extra calories, okay. So it helps the mom to lose some of the weight that you gained during pregnancy. And then number 2, when you're breastfeeding, there's a hormone called oxytocin that is produced. It helps your uterus to contract and go back to its normal size. You know, during pregnancy, uterus yako it just enlarges to accommodate the size of the baby vile ana grow. So when you give birth, it needs to go back to its normal size. And when you are breastfeeding, oxytocin helps it to contract, okay, and go back to its normal size. And also another thing, breastfeeding reduces the risk of getting ovarian cancer and also breast cancer, okay. Imagine by just breastfeeding, you are not at a risk of getting, it reduces the risk of getting breast cancer and also ovarian cancer. So how do you know your baby is full after now breastfeeding? How will I know that, daktari, how will I know that mtoto wangu ameshiba? How will I know? Number 1, the baby should not lose more than 7% of the birth weight in the first few days of delivery. You know, mtoto akizaliwa, kuna wale wanapunguza kilo in the first days, because you know, akiwa kwa tumbo alikuwa amejua chakula inakuja tu through the placenta, mamake anampea chakula akiwa kwa tumbo. Na akizaliwa, this adaptation, kitambo adapt to breastfeeding, ndio apate maziwa ya kutosha ama nutrients za kutosha zitoshane na zile zenye alikuwa anapata kwa mama. But by the time they adjust, some babies wanapunguza kilo kidogo in the first few weeks, and then sasa wana regain, okay. Now wakianza kunyonya vizuri, wanashika tena, wanaongeza kilo yao. So for you to know that huyu mtoto wako anashiba, hafai kupoteza more than 7% of the kgs zenye alizaliwa nazo, okay. So I have told you possibility that after birth atapunguza kilo kidogo and then atapik tena. So hafai kupunguza more than 7% of the kgs zenye alizaliwa nazo. And then number 2, he seems to be content for about 1 to 3 hours. Ukinyonyesha mtoto na alale for 3 hours, that means huyo ni mtoto ameshiba, alinyonya akashiba. But mtoto ukimnyonyesha sahi after 30 minutes analia, jua most probably kama huyu mtoto si mgonjwa ama si ati anaumwa, huyu mtoto hakushiba. Sawa sawa. And then you should be able to change at least 6 diapers in a day. Mtoto mwenye anashiba, you change 4 to 6 diapers in a day. Okay, so what will you do to get enough supply of breast milk? Drink a lot of fluids. Drink water, drink chai, chocolate, drink uji, drink juice, liquid zikuwe kwa wingi. Okay, that is how you will get a milk supply. And also try to avoid stressors, because the moment unaanza kupata stress, maziwa itakatika. Okay, so breastfeeding is a personal choice. Okay, it is a personal choice, so it's upon you to decide if you want to breastfeed your baby or not. But just know that medically you are strongly advised to breastfeed your baby at least for the first 6 months, and then now you will start feeds. Ukianza feeds, you still supplement with breast milk for up to 2 years or 3 years according to your wish. Okay, yes, that is it for this breastfeeding video. Sorry, if you have any question, ask me down there in the comment section. If you have a topic that you want us to cover, please tell me down there in the comment section. And also thank you for those who have subscribed. If you have not, please consider subscribing, and see you in the next session of learning.